Health is Wealth with Dr. Mike is brought to you by Pizzaville, where you can enjoy your favorite pizza guilt-free. Pizzaville's 11-inch extra thin crust pizzas are thinner, lighter, and tastier. Order an 11-inch extra thin crust margarita pizza, only 120 calories a slice. Health is Wealth with Dr. Mike on 1059 The Region.
You're listening to 1059 The Region, and this is Health is Wealth with Dr. Mike Carazza. I'm Tina Cortez, and good morning, Dr. Mike.
Good morning, Tina.
Okay, I got to say, this is one of my favorite shows because our listeners have the opportunity to go one-on-one with you. We've got a bunch of questions. Are you all set?
Yeah, of course.
Okay, so here we go. The first question comes from Jenna in Maple. She writes, I have moved from home for the first time and started university in September. Yes, I'm on the way to putting on the freshman 15 or maybe even the COVID-19 pounds. I've put on more weight than ever before. Dr. Mike, what advice do you have for me to ignite my weight loss? That's a tough one, and it sounds like a common issue for so many.
It is tough, and I think being away from home is probably the most challenging because of the because this happened, obviously, I moved away to university, and I was living on my own for the first time. And so what happens as students, and they call them starving students for a reason, but it's also the diet that gets sort of misconstrued. So what happens is, I was eating like garbage, and I think this was the most important turning point in my life, because it was not until I took a second-year nutrition course, and it was just as an elective for me. And as I took that nutrition course, I says, what am I doing? I'm eating terribly. Mm-hmm. And when I'm discussing that, I mean the lack of fruits, vegetables, and I was eating out. And so when you go out to university for the first time and you move away, you get this wonderful student card that maybe your parents will load for you because they feel like, hey, we can't cook for you, so let's just give you like a bunch of money on a card that you can use in the cafeteria. So what you do as a student is you go gangbusters, and you don't have to cook, you don't have to worry about food, and you think you're good. But what's happening there is now you're eating a lot of processed foods. And depending where you are, I was at the University of Guelph, which they had the best cafeteria, and a lot of the food was actually quite healthy, and they had a lot of healthy options. So I'm not saying that the student that in question here needs to start preparing their own food, although once or twice a week, that's going to be very, very important. But the major aspects here are the healthy options.
Absolutely,
so
and start thinking about that.
Yeah, I never forget, there was like a lot of fried chicken choices, a lot of Chinese food options, which again are fried and fried foods, and then there's either the burger options, or so like I think what's the best part about these particular places is that they have healthy options. So a lot of the places now are doing like roast chickens, and I have a lot of students in my practice, so it's either roast chickens or they'll do some vegetables, they'll have some rice and some salads. So my advice to this particular patient or this particular caller is just really get the nutrients down, okay? You want to get the majority of your vegetables and fruits throughout the day. Now, it's going to be hard because you're studying, you're between exams, you're between classes. Eat a balanced breakfast. Don't stick to just having a muffin or having a bagel with cream cheese. That's not enough. Maybe have some egg, have a slice of toast, try to have some fruits in the morning. A lot of students, like the idea of having yogurts and mix some fruits and make like this little parfait. And this is a little easier so that, you just have to really focus on lunch and then dinner, which is the most important meal as a student, because you might want to skip lunch, but never skip lunch. I think it's important to continually eat the 3 meals a day. And then have the healthier options. Instead of having the Caesar salad, maybe have like a salad with just some olive oil and vinegar, which normal salad bars have this, and so that you can mix it yourself. And that is probably one of the most important changes I could advise, not only to students, but to all patients alike.
Absolutely, so true. We can always, consider those healthier options. Our next question comes from Vivi in Richmond Hill. I'm experiencing pain in my wrist. Some people say it's carpal tunnel. What is that, and how can I treat it without surgery? What are the options here, Dr. Mike?
Well, it's interesting because a lot of wrist pain, and I love this question because I see it a lot in practice. So the wrist pain, depending on the age of the patient, so we don't know the age of the patient, but let's look at a couple of scenarios. First off, how old is the patient? Is this an arthritis condition? Because we have to sort of rule out arthritis. If it's arthritis, it's a more inflammatory condition. Either or, if it's arthritis or not, or a younger individual, this is definitely an inflammation in general, because carpal tunnel is an inflammation of the it sort of entraps the nerve, so that you feel this this agony going in pain for your wrist. So that's the whole area. Now that could be, hey, listen, we're all working at home, we're all on the computer these days, and this is becoming very challenging. So is the wrist pain arthritis? Is it not? We are going to have to differentiate between this, and in medicine, this is something that's important. So is it carpal tunnel or is it not? But I'm going to make a very important point. Now, if this specific vitamin, so vitamin B6, and a deficiency in it will cause wrist pain. Believe it or not, it's very easily diagnosed. So something just as simple as seeing what deficiencies could result in rectifying the situation somewhat is a little easier than you'd think, than just figure it out. But X-rays are necessary. You'd have to rule out if it's arthritis, and depending on the age of the patient, this could be an osteoporosis situation as well, and making sure that the bones are healthy of the individual. Now, this is how thorough we are in practice, and this is what we want to do for our patients. And of course, for this particular patient, they'll probably want to definitely go to see their medical doctor and get a proper diagnosis as opposed to seeing hearsay. And I think that's going to be the most important for this particular case.
So could there be a vitamin B6 deficiency, are you suggesting? And that they could take that to help alleviate this issue, or?
Yeah, they could, for sure. So that's related to wrist pain.
Okay.
And then if it's a joint issue and then it's inflammation, there's essential fatty acid deficiencies as well, like things like omega-3s, specifically from fish, which will actually cause an anti-inflammatory-like effect. There's also the most important things that we discuss on the show. We talk about turmeric and curcumin, as well as being an anti-inflammatory. But again, these have to be run by this patient's family doctor or their medical practitioner, and just to make sure that some of these medications can be used. Of course, we recommend and discuss vitamins on the show, but we definitely want to do this in a healthy and proper way, and that means you got to run these things by your family doctor or your medical practitioner so that they can check you out and making sure that some of these suggestions are right for you.
Okay, Dr. Mike, let's try to squeeze in one more question. It comes from Joseph in King. He wants to know, what advice do you have to treat a cold or flu for someone like him who does not take the flu shot? What do you think, Dr. Mike?
Okay, well, this is a very good question. And the idea is what we've, as naturopaths, been doing since, obviously, the inception of the profession, is we strengthen immune systems, and we build up the individual to make them stronger. Now, we're not saying not to get the flu shot. Of course, we would never suggest that because it's necessary for a lot of individuals, especially immunocompromised. Now, for this particular individual, we're not sure as to why he is not getting the flu shot. So there must be a reason why he's not getting the flu shot. But the idea is to prevent yourself from a cold and flu, you definitely want to look at things like vitamin D. Vitamin D deficiency is a huge risk for not only things like the flu, but we've seen some of the data coming out for even COVID-19 as it's a huge risk factor because it does fight off things like influenza, which is the number one cause of the majority of colds, especially in the winter months. So as the vitamin D from our bodies start diminishing as we become more indoors and we're not outside as much, supplementation of vitamin D, which is a fat-soluble vitamin, is going to be very, very crucial. So that's my point number one. Number two, there's many different remedies that you can look at. In terms of vitamins, I would have to just to say a few, is vitamin C is going to be very important. as well. And, elderberry. And the research on elderberry for influenza is amazing. So I like to promote things that have well-documented evidence to suggest that it's going to be effective to help individuals. So I would never recommend or mention something on the show that I felt is just anecdotal, meaning that I heard somebody took this. So if you can actually see some of the raw data on things like PubMed and some of them cited, the well-documented cited journal articles online, you'll find that things like elderberry is proven, and so is vitamin D proven. So these are really effective. So for this particular patient, Joseph, or this particular caller, Joseph, these are some of the things that you want to look at. And it's very simple. You can just check your vitamin D, get your vitamin D score, understand what your number is, and then you can dose it accordingly. Your doctor would recommend exactly what you need to take accordingly. So again, follow your doctor's advice, look at what other vitamins or medications you are taking and making sure that these are all good for you, but you have to see a healthcare professional in order to find that out.
Okay, so you mentioned elderberry, vitamin C, vitamin D. Are there foods that maybe could help to support or boost our immune system as well at this time of year?
For sure. Well, number one, sugar. Foods that have a lot of sugar, including starchy foods, are going to depress and lower your immune system. So that's number one. So number two, you definitely want to consume more vegetables and fruits as the majority of your diet. But I can appreciate how some people during these cold months don't really want to eat salads, and maybe it's a little bit more cold. So you can make things like a minestrone soup, which is a vegetable broth, and broths are really good. Chicken soup is one of my favorites, and it's actually been well documented and proven to actually help the immune system. So, eating warming foods will definitely help your immune system, and this may be something that I know myself I love during this time. So it also help a lot of the individuals. But diet is going to be crucial, Tina. This is where we need to ease off on the sugars and consume more of things like fiber from vegetables, and eat more fruits and the green leafy vegetables as well, because they're going to have a lot of minerals and a lot of vitamins.
Great advice as usual. Send your questions for Dr. Mike to info@1059theregion.com. After the break, the dietary options at Pizzaville that may surprise you. This is Health is Wealth on 1059 The Region. Stay with us.
Have a question for Dr. Mike? Call us at 416-335-1059. Tweet us at 1059 The Region, or email us at info@1059theregion.com. More with Dr. Mike and Health is Wealth when we come back.
It was a rainy day in Pizzaville when we realised that our extra large pizza is 2 whole inches longer than the so-called extra large from the big pizza conglomerates. How do they even call theirs extra large when Pizzaville gives you 18 whopping inches, steaming hot? Because, let's be honest, who wouldn't want 2 more inches?
Pizzaville Stone-Baked Pizza. Fiercely Canadian. Authentically Italian.
Health is Wealth is back with Dr. Mike on 1059 The Region.
You're listening to 1059 The Region, and welcome back to Health is Wealth. I'm Tina Cortez, and over to Dr. Mike with today's guest.
Thank you, Tina. Joining us on Health is Wealth is the marketing coordinator from Pizzaville, Stephanie Contardi. Thank you, Stephanie, for joining us, and of course, thank you to Pizzaville for sponsoring this show where we're able to discuss healthy options for our listeners. And in this particular episode, we want to discuss and showcase and how Pizzaville has somewhat of healthy options for not only our listeners, but for a lot of the people that are staying home with their children and having a lot of maybe difficult time cooking some and preparing some meals. And I think, it's a good time to showcase some healthy options from Pizzaville. Stephanie, welcome to the show.
Thank you so much, Dr. Mike.
Let's start talking about some healthy options in terms of, people think pizza, of course, is unhealthy. But let's break it down, Stephanie.
I think people think of it as a kind of, a fun treat, kind of something you can treat yourself with. I do think there are definitely healthy aspects to pizza. There you can have all your three major macronutrients while you're enjoying a pizza, and not feel so guilty. And there are definitely some modifications you can make when you're ordering to make it a little more diet friendly.
So depending on the individual, you definitely cater to a lot of individuals and their needs, which I like, and I think it's wonderful because, the typical pizza obviously is made with a gluten crust and conventional mozzarella cheese, which is dairy from, obviously, which is from cows' milk, and and the traditional maybe style would be a very doughy pizza, which that is very thick crust, and maybe after you have one or two slices, you're pretty much done, and then you're bloated. Mm-hmm. So obviously the answer to this is Pizzaville. I think for the last year, you guys have had the vegan, dairy-free mozzarella cheese option which is plant-based. It's dairy-free, it's nut-free, it's gluten-free, soy-free, casein-free, and these are made basically allergen-friendly, which is really good for a lot of my patients who come in and really feel like they can't eat anything because they have a lot of food intolerances. So this is a really big win in that category, and I think having that choice really helps a lot of people because it puts it puts a little bit better choices in there for discussing some options for takeout, right?
Mm-hmm. Definitely. So we introduced our vegan dairy-free mozzarella cheese about a year ago. It did take us some time to really find a ingredient and a topping that we felt still really tasted like the regular cow-based dairy mozzarella cheese, but still had a very clean ingredient deck. And so the current vegan dairy-free cheese that we do offer still has that same really good taste. It has a great texture. It works really well with our dough and with our other ingredients. And it was definitely a demand in the market. There's definitely a demand in the market. There's a demand from our customers for a dairy-free option. People still want that taste of cheese, and cheese is so synonymous with pizza that just removing it still doesn't give you that pizza taste. But having this option of a dairy-free, vegan, plant-based mozzarella still allows people to enjoy their pizza if they have, they have any lactose intolerance, or if they've just been advised to have maybe more of a plant-based diet.
Yeah, and who doesn't like a pizza? And the difficult task in my practice and what I see with patients is, of course, we diagnose a lot of people with food intolerances as maybe they might have some skin issues or some IBS issues or some gut issues. And to know that these options are available, and then one of my personal favorite options as well is your gluten-free crust that gives people, again, that choice to say, wow, I can actually eat this pizza traditionally as it was intended, but with a little bit different ingredients. But I believe, in my personal experience, you're not sacrificing taste or quality. Correct, Stephanie?
That's true. There's actually a lot of people that are, don't have any intolerances to gluten, but actually will prefer our gluten-free crust because of the way it tastes. And it's nice. It's similar to kind of, I would say, kind of like a cracker style taste, and it just really, or flatbread cracker style taste. And it's really a nice, it's a nice type of crust that we've been able to create with actually a gluten-free facility.
Yeah, so it's definitely good for people who are, so for our listeners out there, there's a lot of gluten-friendly options out there, but when you think about the idea of gluten-free, it's very important because there's a lot of people that suffer, and I know many of them, and if not, I'm not diagnosing them, they definitely already come into the office with this, and then they actually have something called celiac disease. Mm-hmm. So celiac disease is actually a very debilitating disease. And in fact, gluten, these individuals cannot even have the slightest amount. Like the pasta, if they go to a restaurant, can't even be boiled in the same water, or a utensil can't even touch. And so the attention to this detail when a restaurant or obviously Pizzaville, like Pizzaville does recognize this. It really does warm my heart, because it gives a lot of choices to these individuals to say there's a route out there that they can actually go out and eat. Because when you have an allergy, or you have a child or a family member, or if you are a person that is an allergy sufferer, it's very challenging to trust another environment or company to go out and actually order some of these options. But, this does bring hope, right, Stephanie?
Yes, there's definitely an option for people that do suffer from gluten intolerances and those who actually are celiac. We do have many customers that have been ordering our gluten-free crust since we first introduced it to the market in 2011. And we're definitely very happy that we're able to provide a type of crust that there's no taste sacrifice. It's still very well received. It's still very tasty. It has flaxseed in it. It's high in fiber. It's trans fat free, lactose free, soy free, corn free, obviously wheat and gluten free. So it is definitely a deck that we're very proud of, and we're very proud of being able to offer it to people that still want to enjoy, their pizza with their family, and they can order their own and in a gluten-free crust.
So, Stephanie, what's the reaction been from your customers, from consumers, about the gluten-free crust, about, the vegan, dairy-free mozzarella cheese? Have they been receptive? Do you get feedback where it says, what, it doesn't taste as good or the same, can you do this? And have you had to adjust?
We've had really great and positive responses to both our gluten-free crust and to our vegan dairy-free mozzarella cheese. We definitely have customers that say ours is the best around. So we do take those testimonials very seriously. We haven't had any negative responses to either product, and we do listen definitely to our customers' feedback. So we do welcome feedback from those customers that are trying these types of alternatives, and luckily, it's been very well received. And I think that's in part due to the length of time it takes us to really either formulate or develop, a deck and a topping or a crust that really doesn't sacrifice taste, but does what we need it to do, which is provide a safe alternative or a more friendly alternative for those that have those intolerances.
Stephanie, for sure, I definitely have to talk more about this, because as it pertains to our show, obviously the show is called Health is Wealth, and it's important how we try to get people more healthy. Besides the fact of the extra thin crust, which, by the way, is pretty low cal, which is awesome that you offer that, and I can appreciate that with the regular gluten. But as a person who predominantly diagnoses people with either gluten sensitivity or gluten intolerance or even celiac disease, I'm interested, and I would like to showcase how magnificent the initiative is, because you've gone even further. Because most people who have a gluten-free crust will make it contain things like corn or trans fats, or put some lactose in there, or put soy, and then there you go. Then you have like a gluten-free crust, and then it contains a lot, pretty much, of garbage. And the one thing I like about your gluten-free crust, and I can say this, and I can be completely honest, is that not only obviously it has the flaxseed, it's high in fiber, and of course there's a lot of research on how flaxseed is very beneficial for you, but it's free of all those major contaminants, in that the trans fat, the lactose, the soy-free, the corn-free. The fact that you guys went corn-free with this, I think, is genius. Corn is a big issue right now, and especially being a big, there's a lot of the people who are gluten-free, are eating corn, and they're getting some serious gut issues because the corn is really not agreeing with them. So it's not just a simple fix. We're just going to get a corn pasta, or we're going to get a corn crust. So I think it really is strong, and it's, obviously it does contain egg and yeast. So, but I'd rather it contain that, in my professional opinion, and I'm really happy. So for our listeners out there, of course, there are choices for you, and thank you for Pizzaville for creating this. And of course, Stephanie, thank you for coming on the show, because it's great information. I mean, can we talk about where listeners can get more information about Pizzaville and some dietary options?
Of course, you can visit pizzaville.ca for a full list of ingredients, nutritionals, and for our full menu.
That's terrific. Thank you for joining us, Stephanie. And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you at Applemed, where can they find you?
I could reach us at applemed.ca or on Instagram, Applemed Clinic. They can call our office at 905-303-4622. Come by the clinic. We're here. Obviously, we have screening protocols in place, but we're more than happy to field your questions, call into the station, and we'd love to help you. And everybody, to our listeners, thanks for listening. Stay healthy. And this is Health is Wealth with Dr. Mike.
And that's it for us. Previous episodes of Health is Wealth on 1059theregion.com. Thanks for listening.
Connect with us on Twitter at 1059theregion or call 416-335-1059 or email info@1059theregion.com. This is 1059 The Region. Health is Wealth is brought to you by Applemed Clinic, located at 3560 Rutherford Road, Unit 45. Applemed takes a results-driven approach to patient care. Remember, an Applemed day keeps illness away.